Oxygen uptake. Aerobic exercise. The oxygen demand of working muscles increases during an acute bout of aerobic exercise and is directly related to their mass, metabolic efficiency, and level of work. Aerobic exercise involving a large mass of muscle or greater level of work is likely to be associated with a higher total oxygen uptake. Increased metabolic efficiency allows for an increase in the oxygen uptake, especially at maximal exercise. Maximal oxygen uptake is described as the greatest amount of oxygen that can be used at the cellular level for the entire body. It has been found to correlate well with the degree of physical conditioning and is recognized as the most widely accepted measure of cardiopulmonary fitness. The capacity to use oxygen is related primarily to the ability of the heart and the circulatory system to transport oxygen and to the ability of the body tissues to use it. Resting oxygen uptake is estimated at 3.5 milliliters of oxygen per kilogram of body weight per minute, ml times kg to the -1 times minute to the -1. This value is defined as 1 metabolic equivalent, MET. Maximal oxygen uptake values in normal, healthy individuals generally range from 25 to 80 milliliters of kilogram per minute, or 7.1 to 22.9 mets, and depend on a variety of physiological parameters, including age and conditional level. Oxygen uptake VO2 can be calculated as follows. VO2 equals Q times A VO2 difference, where Q is the cardiac output in milliliters per minute, and A VO2 difference is the arterial venous oxygen difference, the difference in oxygen content between the arterial and venous blood, in milliliters of oxygen per 100 milliliters of blood, for example. To get the usual units for oxygen uptake, i.e. milliliters per kg per minute, the result would then be divided by the person's weight in kilograms. Equation 7.2 is a manipulation of the Fick's equation, which expresses the relationship of cardiac output, oxygen uptake, and arterial venous oxygen difference. This equation is helpful in understanding the relationship of each parameter to the others and in developing a clearer picture of how exercise may affect each. Resistance exercise. Heavy resistance training is not associated with an acute increase in oxygen uptake, although, as previously mentioned, the acute response of oxygen uptake may increase and resistance decreases substantially. Blood pressure. Systolic blood pressure is used to estimate the pressure exerted against the arterial walls as blood is forcibly ejected during ventricular contraction, systole, and when combined with the heart rate, can be used to describe the work of the heart. This estimate of the work of the heart is obtained according to the following equation and referred to as the rate pressure product, or double product. Rate pressure product equals heart rate times systolic blood pressure. Conversely, diastolic blood pressure is used to estimate the pressure exerted against the arterial walls when no blood is being forcefully ejected through the vessels. Diastole. It provides an indication of peripheral resistance and can drop somewhat with aerobic exercise due to vasodilation, or can actually increase significantly with heavy resistance exercise due to vasoconstriction. In systemic circulation, pressure is highest in the aorta and arterioles and rapidly falls off within the venous circulation. Figure 7.9. Also, because pumping by the heart is pulsatile, arterial pressure fluctuates between systolic levels of 120 milligrams mercury and a diastolic level of 80 approximate values. As the blood flow continues through the systemic circulation, its pressure falls progressively to nearly 0 milligrams of mercury venous pressure by the time it reaches the termination of the vena cava in the right atrium. The mean arterial pressure is the average blood pressure throughout the cardiac cycle, equation 7.5, and is not the average of the systolic and diastolic pressures. However, rather because the arterial pressure usually remains nearer to the diastolic level than the systolic level during greater portion of the cardiac cycle, and mean arterial pressure is usually less than the average of the systolic and diastolic pressures. Mean arterial blood pressure equals systolic blood pressure minus diastolic blood pressure divided by 3 plus diastolic blood pressure. Normal resting, that's figure 7.5, normal resting blood pressure generally ranges from 110 to 139 milligrams of mercury systolic and 60 to 89 milligrams of mercury diastolic. With aerobic exercise, maximal exercise in some people, systolic pressure can normally rise as much as 220 to 260, while diastolic pressure remains at the resting levels or decreases slightly. In comparison, extremely high blood pressure values have been observed during heavy resistance exercise, 300 to 180, especially during Valsalva maneuver. Ordinarily, however, values are much lower than these, particularly as load is reduced. Control of local circulation. Blood flow is a function of resistance in the body. As resistance is reduced, blood flow is increased, and as resistance increases, blood flow is reduced. The amount of resistance to blood flow is primarily a function of the diameter of the systemic vessels. The resistance of the entire systemic circulation is called the total peripheral resistance. As blood vessels throughout the body become constricted, total peripheral resistance increases with dilation. Peripheral resistance decreases. Resistance to blood flow is also affected by the viscosity of the blood, primarily the result of frictional drag of the suspended red blood cells, the length of the vessel. However, these factors remain relatively constant under most circumstances. Thus, the constriction and dilation of the blood vessels, called vasoconstriction and vasodilation respectively, are the primary mechanisms for regulated regional blood flow. Aerobic exercise. During aerobic exercise, blood flow to active muscles is considerably increased by the dilation of local arterioles, and at the same time, blood flow to other organ systems is reduced by constriction of their arterioles. At rest, 15 to 20% of cardiac output is distributed to skeletal muscle, whereas the vigorous exercise, this value may rise to 90% of cardiac output. Resistance exercise. The degree to which blood flow is increased in the working muscles during resistance training depends on the intensity of the resistance, length of time, and effort, and the size of the muscle mass. Lower resistance over a longer duration produces responses relatively similar to that of the aerobic type work. However, heavy resistance exercise increases resistance to working muscle blood flow. The Valsalva maneuver. Named for the 18th century physician Antonio Valsalva, this maneuver can be used in the evaluation of the cardiovascular system, but more frequently may be observed during resistance exercise, is simply described as airway straining during an attempt to forced expiration during a closed glottis. The result, dependent upon the duration and intensity of the maneuver, is an increase in intrathoracic pressure, leading to decreased venous return and reduced cardiac output. The responses of these effects are A, an increase in the heart rate to maintain cardiac output, and B, vasoconstriction to maintain blood pressure, which may otherwise fall as a result of the decreased cardiac output. Again, dependent upon the extent of the maneuver, athletes may become lightheaded or even syncopal as a result of the reduced cardiac output. Upon release of the strain, the venous return is dramatically increased, and consequently so is cardiac output. This increased cardiac output moving through a somewhat constricted arterial system may result in larger increases in blood pressure, which may take some time, minutes, to normalize.